Good morning, everyone. It's a great pleasure to be here. And thank you for Emmanuel Stip for inviting us here. So my name is Viktorija Aksionova. I'm a co-founder and CEO of Mindtales, mental well-being application. COVID undoubtedly affected everyone. A lot of people feel stressed, anxiety, and burnout. A phenomenon known as Great Resignation is in a full swing. People are quitting their jobs in order to find more supportive work environment. And at the same time, employers don't realize how much mental health costs, and in particular, indirect cost. And it can sum up to $30,000 per employee per year. And employers can take more proactive approach in managing their employee well-being. And there are different types of interventions. And the earlier the intervention, the higher return on investment, averaging $5.2 invested. Mental health treatment historically was based on subjective data, on trial and error approach. And now with advancement in technology, AI, and data, we can make mental health more objective, accessible, and affordable to many people. Look at the human from a holistic perspective. Physical and mental health are two sides of the same coin. And that's why we created Mindtales. And we have an amazing team. We have 9 nationalities from different backgrounds, and the team is here, so please feel free to talk to them after our chat. And we have a great advisors, so a few familiar faces here. And we've been lucky to have a great support from the local ecosystem, from the accelerators, government, healthcare providers, and universities. So our mission is to fight mental health stigmas, enable employers to understand, engage, and support with their employees. So Mindtales is a mental well-being application. We have created a digital therapy course based on cognitive behavioral therapy. So how does it work? People download the app, answer a few questions, and then we provide different recommendations. Exercises takes 5 to 10 minutes to complete. It can be breathing, meditation, wellness games based on cognitive behavioral therapy. And people who need more help and support, we provide access to wellness coaches and counselors. And at the same time, people can track their progress and see their achievements. And we are very excited to share the results of our product. Dr. Nahida will take it from here.
Assalamu alaikum. Good morning, everybody, and lovely to see you again. Thank you, Viktorija. And my journey with Mindtales started when it was just a seed before it went into the soil. Ahmed and Viktorija came to me about almost 2 years now. And as I said yesterday, I think COVID gave us the wings that mental health needed. We've been in status quo and stagnation for a number of years. And thanks to COVID, we've gained that momentum that needed to bring mental health to the next level. And as I also mentioned yesterday, from a provider's perspective, my goal in associating with these apps were not just about, promoting the apps blindly, but also to look at their feasibility and adaptability. Does this do what it promises to do? Or is there something that needs to be changed? So for me, it's been a privilege to be an advisor where I can give a feedback in terms of what needs to be modified based on the user adaptability. So the results we're presenting today are basically from the user data. Besides this, Mindtales is also involved in 2 research studies that have been approved by Department of Health. One of the studies involves the university students, and the other one is very much in alignment with the primary care integration, which is a huge part of our mental health strategy that we spoke about yesterday. So Mindtales is going to be studying the feasibility of being an adjunct to psychopharmacology provided by primary care provider. And the other one is for self-help in universities. But let's see what we found out so far with the data user. So the study, it wasn't a research study as such, but the analysis was done for adults between 18 to 45 years of age, most of them from the MENA region, and 70% of them are Arabic speakers. They were asked to use the app. The app is beautifully designed. You should try someday. It starts with a baseline assessment of your mental status using PHQ-9 and GAD-7, which is again in alignment with the Department of Health strategic plan, because those are the scales we use in screening in Abu Dhabi. So users are asked to do the ratings at the baseline, and then they use the sessions. It could be self-help, and there is a intervention available through online counselors. But for the purpose of this data, there were no, folks involved in the online counseling were not enrolled. Having said that, we don't know if in real life these people had access to psychotherapy. We're measuring the data that we found from people who used the sessions and the self-help sessions, basically. So basically, like Viktorija mentioned, the course is divided into sessions. It could be, users can use it at their own liberty. There are different aspects to the sessions, which addresses the CBT modules, like cognitive distortions and restructuring of your, thought process. So as you can see, the sessions has different exercises listed, and based on their convenience, people can choose what they would like to do. We have tried to stick to 7 weeks of usage before we could extract the data. And the way we graded the response, the user adaptability and the user feedback was based on these emojis, like you can see on the left. It could be happy and confident to as worse as overwhelmed. So before and after using the sessions, the user is asked to grade how they were feeling. It was quite staggering to know that so many of them had scored very high scores on PHQ-9 and GAD-7, which basically comes to the realm of psychotherapy, beyond psychotherapy into psychopharmacology at times. However, after the usage, we saw a steady decline in those scores, which is very promising because we can assure that patients, just through the self-help and the guided technology that's provided through this app, can find relief. So we all know majority of the time we have difficulty accessing. It could be because of stigma, it could be because of insurance coverage, a number of other reasons. But apps like this, platforms like these makes it easier for people to access the much needed help from the comfort of their homes. So 56% scored, they showed positive response in resolving their anxiety, and 58% for their depressive symptoms. The efficacy, this could be a little difficult. I had difficulty this morning understanding how the graph goes, but apparently it is the more you move towards the left, it's better. So if you could see, when people start saying that they were 27% of the time they were too worried, it came down to 3% after use. So it is in a good direction. So majority of the people who scored really high showed some resolution, if not complete, by the time they finished the 7 weeks courses. So there is promise in the horizon, and I'm really grateful not just to Mindtales, but many other apps that will be presenting today for the tremendous work they do. And as a mental health provider, and on behalf of my patients, I'd like to thank all of you for that enthusiasm to do more for the community. Thank you.